nclex-rn Previous Question Papers, 2026. Question 1. The charge nurse overhears an AP yelling loudly to a patient who is hard of hearing while transferring them. Which response by the charge nurse is most appropriate? A. Please speak more quietly so you don't disturb the other patients. B. Let me help you with your transfer technique. C. When you are finished, be sure to apologize for shouting. D. When your patient is safe and comfortable, meet me at the desk. The correct answer is when your patient is safe and comfortable, meet me at the desk. The charge nurse should direct the AP to see to the patient's safety, then address any concerns privately to discuss therapeutic communication. Question 2. A public health nurse is leaving the home of a young mother with a special needs infant. The neighbor asks, "How is she doing, since the baby's father is no help?" What is the best response? A. The new mothers need support. B. The lack of a father is difficult. C. How are you today? D. It is a very sad situation. The correct answer is new mothers need support. The nurse must maintain confidentiality. The statement new mothers need support is general and non-judgmental. How are you today is dismissive. Question 3. A toddler with vomiting, diarrhea, and dehydration is being admitted. What question will the nurse ask the parents to elicit the most useful information? A. Watching your child vomiting and in discomfort must have been scary. B. This started yesterday, correct? C. Has this child has had anything to drink? D. Could you tell me the color and approximate amount of the vomiting? The correct answer is could you tell me the color and approximate amount of the vomiting? Using a clarifying question allows the nurse to gain an understanding of the parent's observations. Open-ended questions encourage free verbalization. Question 4. A nurse enters a patient's room and is asked, "Who are you?" Which response is most appropriate? A. I'm just the fourth therapist checking your for. B. I've been transferred to this division and will be caring for you. C. I'm sorry, my name is John Smith and I am your nurse. D. I am John Smith, your nurse, and I'll be caring for you until 11 p.m. The correct answer is I am John Smith, your nurse, and I'll be caring for you until 11 p.m. The nurse should identify themselves, ensure the patient knows what will be happening, and the duration of their relationship. Question 5. A patient with cancer is crying and states, "I feel so alone." How will the nurse best communicate a therapeutic response? A. State, "I understand how you feel. My mother said the same thing when she was ill." B. Place a hand on the patient's arm and state, "You feel so alone." C. Pass, "Why do you feel so alone? Your wife has been here every day." D. Hold the patient's hand and ask, "Tell me what feeling so alone is like for you." The correct answer is hold the patient's hand and ask, "Tell me what feeling so alone is like for you." The use of touch conveys acceptance, and the implementation of an open-ended question allows the patient time to verbalize freely. Question 6. A primary nurse is preparing a discharge plan for a patient following a double mastectomy. Which statement is most appropriate for the termination phase of the therapeutic relationship? A. Let's review the progress you've made in meeting your goals. B. I'd like to review your medication schedule with you. C. I need to document today's teaching session in the electronic health record. D. Should we include your family in today's session? The correct answer is let's review the progress you've made in meeting your goals. Discharge planning correlates with the termination phase of a therapeutic relationship where progress toward the patient's goals are reviewed. Question 7. A nursing student is nervous about working at a clinical facility. Which action would best decrease anxiety and help ensure successful delivery of patient care? A. Determining the established goals of the institution. B. Ensuring that verbal and nonverbal communication is congruent. C. Engaging in self-talk to plan the day and decrease fear. D. Speaking with fellow colleagues about how they feel. The correct answer is engaging in self-talk to plan the day and decrease fear. By engaging in positive self-talk, or intrapersonal communication, the nursing student can plan the day, decrease fear and anxiety, and enhance clinical performance. Question 8. A nurse wants to modify their communication for a more positive interaction regarding a denied day off. Which response is best? A. I placed a request to have 8th of August off for a doctor's appointment, but I'm scheduled to work. B. Could I make an appointment to discuss my schedule with you? I requested the 8th of August off. C. I will need to call in on the 8th of August because I have a doctor's appointment. D. Since you didn't give me the 8th of August off, will I need to find someone to work for me? The correct answer is could I make an appointment to discuss my schedule with you? I requested the 8th of August off. Effective communication involves sending clear, non-threatening, and respectful information. The nurse identifies the subject and determines a mutually agreed upon time. Question 9. A nurse notices a patient is walking to the bathroom with a stooped gait, facial grimacing, and grunting sounds. What action will the nurse take next? A. Assess for pain and the need for analgesia. B. Task the patient if they feel anxious. C. Offer to sit with the patient and listen to their feelings. D. Suggest the patient increase their fluid intake to prevent constipation. The correct answer is assess for pain and the need for analgesia. A patient who presents with nonverbal communication of a stooped gait, facial grimacing, and grunting sounds is most likely communicating pain. Question 10. A nursing student is preparing to administer morning care to a patient. What question is most important to ask? A. Would you prefer a bath or a shower? B. May I help you with a bed bath now or later this morning? C. I will be giving you your bath. Do you use soap or shower gel? D. I prefer a shower in the evening. When would you like your bath? The correct answer is may I help you with a bed bath now or later this morning? The nurse should ask permission to assist the patient. This allows for patient preferences and consent for care that involves entering personal space. Question 11. A nurse enters a patient's room and finds them vomiting bright red blood. Which information will the nurse include in the portion of the SPAR communication? A. Admitted with peptic ulcer and bleeding disorder. B. Found vomiting in bathroom. C. Anti-ulcer medication recommendation. D. Vital signs, oxygen saturation, bright red emesis. The correct answer is vital signs, oxygen saturation, bright red emesis. SPAR, situation, background, assessment, recommendations. Vital signs, oxygen saturation, and the presence/color of emesis are assessments. Question 12. A graduate nurse is performing a preoperative assessment. Which statement requires the preceptor to intervene? A. I am sure everything will be fine, you have nothing to worry about. B. When you return from surgery, you'll need to cough and deep breathe. C. Many people on this unit have had that procedure with good success. D. You seem fearful, can I answer any questions about the procedure? The correct answer is I am sure everything will be fine, you have nothing to worry about. Telling a patient that everything will be fine is a cliché and offers false assurance, which blocks therapeutic communication. Question 13. A patient states, I have been experiencing complications of diabetes. What question will the nurse use to elicit additional information? A. Do you take 2 injections of insulin to prevent complications? B. Are you using diet and exercise to help regulate your blood sugar? C. Have you been experiencing the complications of neuropathy? D. Can you tell me about the complications you've experienced? The correct answer is can you tell me about the complications you've experienced? Requesting information regarding the specific complications experienced will guide the nurse to further questioning and related assessments. Question 14. A nurse researcher interviews adults to validate Erickson's theory. Which patient's statement correlates to the stage of generativity versus stagnation? A. I am helping my parents move into an assisted living facility. B. I spend all of my time going to the doctor to be sure I am not sick. C. I have enough money to help my son and his wife when they need it. D. I earned this gray hair and I like it. The correct answer is I spend all of my time going to the doctor to be sure I am not sick. Middle adults who do not reach generativity tend to become overly concerned about their own physical and emotional health needs, stagnation. Question 15. Which health problem is most appropriate for many middle-aged adults, age 55 plus? A. Adequate nutrition. B. A mental health problem. C. The abuse. D. Caregiver role strain. The correct answer is caregiver role strain. Many middle-aged adults help care for aging parents and have concerns about their own health, leading to caregiver role strain. Question 16. The charge nurse asks nurses to intervene if they observe which example demonstrating ageism? A. Encouraging older adults to apply makeup to promote positive self-image. B. Explaining to an older adult they could learn to use video conferencing. C. Stating that an older adult should not think about having a boyfriend or girlfriend. D. Recognizing the patient who lost their partner may be experiencing loneliness. The correct answer is stating that an older adult should not think about having a boyfriend or girlfriend. Ageism is a form of prejudice in which older adults are stereotyped. The other statements are positive, building on strengths. Question 17. A nurse is caring for older adults in a senior adult day services (ADS) center. Which finding requires follow-up? A skin pigmentation caused by exposure to sun over the years. B thin toenails with a bluish tint to the nail bed. C using a walker while healing from a hip fracture. D bruising on forearms due to fragile blood vessels in the dermis. The correct answer is thin toenails with a bluish tint to the nail beds. Older adults' toenails may become thicker, not thinner. A bluish tint may indicate hypoxemia, low oxygen. Question 18. Which statement will students identify as a myth about older adults? A. Most older adults live in their own homes. B. Healthy older adults enjoy sexual activity. C. Paging results in mental deterioration. D. Older adults want to be attractive to others. The correct answer is aging results in mental deterioration. Intelligence does not normally decrease because of aging. Assuming mental deterioration is a myth. Question 19. A nurse is helping to prepare a calendar for an older adult patient with cognitive impairment. Which type of cognitive impairment is non-reversible? A. Post-stroke speech issues. B. Malnutrition. C. Alzheimer's disease. D. Loss of cardiac reserve. The correct answer is Alzheimer's disease. Alzheimer's disease causes progressive, irreversible cognitive impairment. Question 20. A nurse uses reminiscence to help an older adult adapt to aging. Which question encourages reminiscence? A. Tell me about how you celebrated Christmas when you were young. B. Tell me how you plan to spend your time this weekend. C. Did you enjoy the choral group that performed here yesterday? D. Why don't you want to talk about your feelings? The correct answer is tell me about how you celebrated Christmas when you were young. Use of life review or reminiscence encourages reflection on past experiences. Question 21. The nurse in a long-term care facility states in report that an older adult resident is quite frail. The oncoming caregiver prioritizes prevention of what problem? A confusion. B a falls. C a delirium. D a dementia. The correct answer is falls. Fear of falling and frailty contribute to falls in older adults. Falling once doubles the chance of falling again. Question 22. A patient is admitted with change in mental status and dehydration. Which of these reflects a reversible cause of the changes in mental status? A. Alzheimer's disease. B a delirium. C a dementia. D a delirium superimposed on dementia. The correct answer is delirium. Delirium is an acute syndrome that can resolve with treatment of the underlying cause, example, dehydration. Question 23. A community health nurse is providing education on child safety. Who is at highest risk for choking and suffocation? A. A toddler playing with his older brother's wooden blocks. B. A 4-year-old eating yogurt and strawberries for lunch. C. An infant sleeping in the prone position. D. A 3-year-old drinking a glass of juice. The correct answer is an infant sleeping in the prone position. Infants should be placed on their backs to sleep to prevent SIDS and suffocation. Question 24. A patient admits that they smoke a cigarette in bed before falling asleep. Which health problem is the priority? A. Impaired gas exchange. B. Acute anxiety. C. Non-adherence. D. Knowledge deficiency regarding burn risks. The correct answer is non-adherence. Denial that smoking in bed poses a danger requires education about the risk for burns and suffocation. Question 25. A parent calls saying their child ingested a toxic substance. How will the nurse advise the parents? A. Administer activated charcoal and go to the ED. B. Administer syrup of ipecac and go to the ED. C. Bring the child in for gastric lavage. D. Call the poison control center immediately. The correct answer is call the poison control center immediately. The nurse tells the parents to call the PCC immediately before attempting any home remedy. Question 26. A nurse is teaching parents about car seats. What should be the focus of this education? A. Booster seats should be used until the child is 4 feet 9 inches and 80 to 100 pounds. B. Most states mandate infant seats only for long trips. C. Infants should be front-facing by 6 months. D. Children older than 6 years may use a standard seat belt. The correct answer is booster seats should be used until the child is 4 feet 9 inches and 80 to 100 pounds. Booster seats should be used for children until they are 4 feet 9 inches tall and weigh between 80 and 100 pounds. Question 27. A nurse in a long-term care facility wants to protect older adults from injury. Which action should be prioritized? A. Ensuring proper function of fire alarms. B. Preventing exposure to temperature extremes. C. Screening for partner or elder abuse. D. Maintaining clutter-free rooms and hallways. The correct answer is maintaining clutter-free rooms and hallways. Falls are the most common cause of trauma admissions for older adults. Clutter-free paths prevent falls. Question 28. The preceptor intervenes when observing which action by a graduate nurse caring for a confused patient? A. Raising all 4 side rails to keep the patient in bed. B. Performing documentation in the patient's room. C. Suggesting obtaining a patient sitter. D. Using a bed alarm to alert staff. The correct answer is raising all 4 side rails to keep the patient in bed. Raising all 4 side rails is considered a restraint and can cause injury if the patient tries to climb over them. Question 29. The hospital's fire alarm sounds. What is the priority for nurses on the unit? A. Removing patients from the room or vicinity. B. Attempting to put out the fire. C. Closing all the doors on the unit. D. Running to the closest unit and requesting help. The correct answer is removing patients from the room or vicinity. The nurse uses the acronym RACE, rescue/remove the patient first. Question 30. A nurse is filing a safety event report for a patient who fell. Which action is most appropriate during documentation? A. Including suggestions on how to prevent recurrence. B. Providing minimal information. C. Discussing the details with the patient first. D. Recording the circumstances in the health record. The correct answer is recording the circumstances in the health record. The nurse is responsible for recording the circumstances and the effect on the patient in the medical record. The event report itself is internal. Question 31. Nursing students are participating in a disaster drill. Which assignment is most appropriate for them? A. Cleansing and dressing wounds. B. Triaging patients with respiratory symptoms. C. Providing information to families. D. Ensuring everyone entering has an N95 mask. The correct answer is ensuring everyone entering has an N95 mask. Delegating tasks to students must be based on skill level. Ensuring masks are worn is within their capability. Question 32. A disoriented older resident wanders the halls but becomes agitated when they cannot find their room. Which alternative to restraints is most appropriate? A. Placing them in a geriatric chair. B. Using sheets to secure them in bed. C. Keeping the bed in the high position. D. Identifying their door with his photograph and a balloon. The correct answer is identifying their door with his photograph and a balloon. Identifying the door helps the resident find their room, resolving the agitation without physical restriction. Question 33. Following guidelines for restraints, which nursing action reflects safe practice? A. Positioning the patient in supine position with wrist restraints. B. Ensuring that 2 fingers can be inserted between the restraint and wrist. C. Applying a cloth restraint to the arm within 4 catheter. D. Tying an elbow restraint to the raised side rail. The correct answer is ensuring that 2 fingers can be inserted between the restraint and wrist. The nurse must be able to place 2 fingers between the restraint and the patient's skin to ensure circulation is not cut off. Question 34. During admission, a nurse orients an older adult to their hospital room. What is the current safety priority? A. Explaining how to use the telephone. B. Introducing the patient to their roommate. C. Reviewing the hospital policy on visiting hours. D. Demonstrating how to operate the call bell. The correct answer is demonstrating how to operate the call bell. Knowing how to use the call bell is a safety priority so the patient can request assistance. Question 35. A nurse is teaching new parents about newborn safety. Which comment indicates further teaching is required? A. I can expect my newborn to sleep 16 to 24 hours a day. B. Eye movements or groans during my baby's sleep is an emergency. C. It is essential that I place my infant on their back to sleep. D. I will not place pillows or blankets in the crib. The correct answer is eye movements or groans during my baby's sleep is an emergency. Eye movements and groaning are normal activities during newborn sleep, no emergency exists. Question 36. A nurse observes involuntary muscle jerking in a sleeping patient. What action will the nurse take next? A. No action is necessary, this is normal in stage 1 sleep. B. Report the neurologic deficit to the provider. C. Lower the temperature in the room. D. Awaken the patient, as this is an indication of night terrors. The correct answer is no action is necessary, this is normal in stage 1 sleep. Involuntary muscle jerking, hypnic jerks, occurs in stage I NREM sleep and is a normal finding. Question 37. A nurse is teaching about sleep hygiene in older adults. What teaching point will the nurse include? A. Drinking a cup of regular tea at night induces sleep. B. Using alcohol moderately promotes a deep sleep. C. Eating a bedtime snack high in tryptophan and carbohydrates improves sleep. D. Exercising right before bedtime can hinder sleep. The correct answer is eating a bedtime snack high in tryptophan and carbohydrates improves sleep. A small bedtime snack high in tryptophan and carbohydrates improves sleep. Tea has caffeine, alcohol limits REM. Question 38. A nurse in a pediatric unit notes a school-aged child snores and has labored breathing during sleep. Which assessment question is relevant? A. Do you have trouble sleeping? B. Have you missed a lot of school? C. Have you been wetting the bed lately? D. Do you have a history of high blood pressure? The correct answer is have you been wetting the bed lately? Pediatric obstructive sleep apnea, OSA, is defined by snoring, obstructed breathing, and often enuresis, bedwetting. Question 39. A nurse in a rehabilitation facility develops a plan to help promote patients' sleep. What intervention will the nurse include? A. Maintain a consistent bedtime and time to awaken. B. Drink 2 or 3 glasses of water at bedtime. C. Have a large snack at bedtime. D. Take a sedative hypnotic every night at bedtime. The correct answer is maintain a consistent bedtime and time to awaken. Keeping a consistent bedtime and awakening schedule helps promote sleep. Question 40. A student plans to discuss retiming a medication for an older adult who was up all night to use the bathroom. Which medication is the likely cause? A. Furosemide, diuretic. B. Melatonin. C. Acetaminophen. D. Artificial tears. The correct answer is furosemide, diuretic. Diuretics cause urination and should be administered in the morning or early evening to prevent nocturia. Question 41. A nurse caring for patients in a long-term care facility wants to promote sleep. Which is the best action? A. Increase physical activities during the day. B. Encourage short periods of napping during the day. C. Increase fluids during the evening. D. Dispense diuretics during the afternoon hours. The correct answer is increase physical activities during the day. Daily physical activity promotes sleep. Napping and evening fluids can hinder night sleep. Question 42. A patient asks about using over-the-counter sleep aids like melatonin. What information can the nurse give? A. Melatonin, a hormonal sleep aid, has varied effectiveness. B. Lavender is a hormonal scented sleep aid. C. Lorazepam is a naturally occurring benzodiazepine. D. Valerian is a natural hormonal sleep aid. The correct answer is melatonin, a hormonal sleep aid, has varied effectiveness. Melatonin is a hormone thought to regulate the sleep-wake cycle and is used as a supplement. Question 43. A nocturnal polysomnography study is prescribed. What teaching will the nurse provide? A. This is a blood test for leptin levels. B. The patient is monitored overnight to evaluate for sleep apnea. C. The patient is evaluated for leg jerking only. D. Only adults can be diagnosed with this test. The correct answer is the patient is monitored overnight to evaluate for sleep apnea. Polysomnography is an overnight sleep study to determine if an individual has sleep apnea. Question 44. A patient reports diffuse abdominal pain that is difficult to localize. The nurse documents this as which type of pain? A. Cutaneous, B. Visceral, C. Superficial, D. Somatic. The correct answer is visceral. Visceral pain is poorly localized and originates in body organs in the abdomen. Question 45. Which question is most helpful in determining if a patient with a myocardial infarction has referred pain? A. Did your chest pain last 2 minutes or less? B. Was the pain on the surface of your chest? C. Is this pain in your residual limb shooting or burning? D. Are you having any arm or shoulder pain? The correct answer is, are you having any arm or shoulder pain? Referred pain is perceived in an area distant from its point of origin, example, shoulder pain during a heart attack. Question 46. A nurse places which patient at risk for pain related to mechanical activation of pain receptors? A. Older adult on bedrest following cervical spine surgery. B. Patient with a severe sunburn. C. Industrial worker with acid burns. D. Patient experiencing electrical shock. The correct answer is older adult on bedrest following cervical spine surgery. Friction from bed linens or pressure on bones/tissues is a mechanical stimulant. Question 47. What is a potent pain-blocking neuromodulator released through relaxation techniques? A. Prostaglandins. B. A substance. C. Endorphins. D. Serotonin. The correct answer is endorphins. Endorphins are powerful pain-blocking chemicals that have prolonged analgesic effects and produce euphoria. Question 48. Applying the gate control theory, what intervention helps relieve pain by closing the gate? A. Encouraging regular use of analgesics. B. Applying moist heat to the area at intervals. C. Reviewing the pain experience. D. Ambulating the patient after medication. The correct answer is applying moist heat to the area at intervals. Cutaneous stimulation, like heat, stimulates large nerve fibers to close the gate and block pain transmission. Question 49. A postoperative patient asks about pain management. What teaching will the nurse provide? A. Avoid asking for pain medication often. B. It is better to wait until the pain is severe. C. It's natural to have pain, it will lessen in days. D. You will be more comfortable if you take the medication at regular intervals. The correct answer is, you will be more comfortable if you take the medication at regular intervals. Pain is harder to control once it becomes severe. Regular dosing prevents breakthrough pain. Question 50. The nurse is assessing the pain of a neonate in the NICU. Which pain assessment scale is best? A. Cries. B. Comfort. C. Flack. D. Faces. The correct answer is cries. The cries pain scale is intended for use with neonates and infants from 0 to 6 months. Question 51. Which pain management method is most effective for chronic pain not related to cancer? A. Highest effective dose of an opioid PRN. B. Using non-opioid drugs conservatively. C. Applying multimodal non-pharmacologic and non-opioid therapies. D. Continuous intravenous infusion. The correct answer is applying multimodal non-pharmacologic and non-opioid therapies. Multimodal therapies are preferred for chronic pain to minimize opioid use and maximize relief. Question 52. When assessing pain in a child, what consideration is valid? A. Immature neurologic development results and reduced pain sensation. B. Inadequate or inconsistent relief of pain is widespread. C. Reliable assessment tools are unavailable. D. Narcotic analgesic use should be avoided. The correct answer is inadequate or inconsistent relief of pain is widespread. Children do feel pain, but inconsistent relief is a common issue. Tools exist, and opioids can be used safely if monitored. Question 53. A pregnant woman has received an epidural. Assessment for which outcome is the priority? A. Pruritus. B. Urinary retention. C. Vomiting. D. Respiratory depression. The correct answer is respiratory depression. Opioids via epidural can cause respiratory depression, which is life-threatening. Question 54. A patient is receiving a continuous opioid infusion. When would the nurse immediately notify the provider? A respiratory rate of 11/min. B. Sedation level of 4, somnolent. C. Mild forgetfulness. D. Reported constipation. The correct answer is sedation level of 4, somnolent. A sedation level of 4 indicates the patient is somnolent with minimal response, a precursor to respiratory arrest. Question 55. A patient with phantom limb pain reports a bloody bowel movement. Which medication requires notification of the provider? A. Acetaminophen. B. Nonsteroidal anti-inflammatory, NSAID. C. Opioid medication. D. Anti-anxiety medication. The correct answer is nonsteroidal anti-inflammatory, NSAID. NSAIDs are contraindicated in patients with bleeding disorders or active bleeding. Question 56. A family member is pressing the PCA button for a patient. What is the nurse's best response? A. That dose will sure be helpful. B. Having only the patient use the pump prevents respiratory complications. C. If the patient asked you to press the button, then it's okay. D. Since the pump has safeguards, you can help. The correct answer is having only the patient use the pump prevents respiratory complications. PCA by proxy, family pressing the button, can lead to overdose. Only the patient should operate the PCA. Question 57. A nurse calculates the BMI of a person who weighs 68 kilograms and is 1.65 m tall. 68/1.65 squared. What is the BMI? A. 25 kilograms per square meter. B. 46 kilograms per square meter. C. 68 kilograms per square meter. D. 165 kilograms per square meter. The correct answer is 25 kilograms per square meter. 68 divided by 1.65 asterisk 1.65 equals approximate 24.98, rounded to 25. Question 58. A nurse is feeding an older adult patient with dementia. What intervention promotes nutritional intake? A. Stroke the underside of the patient's chin to promote swallowing. B. Serve meals in different places. C. Offer a whole tray of various foods. D. Avoid between meal snacks. The correct answer is stroke the underside of the patient's chin to promote swallowing. Stroking the chin promotes swallowing. Meals should be routine, and choices limited to avoid overwhelming the patient. Question 59. A patient with COPD is experiencing anorexia. Which intervention stimulates appetite? A. Administering pain medication after meals. B. Encouraging the family to bring food from home. C. Scheduling nebulizer treatments before meals. D. Reinforcing the importance of eating. The correct answer is encouraging the family to bring food from home. Familiar food from home may stimulate the appetite better than hospital food. Question 60. A nurse is feeding a patient with dysphagia. Which intervention best prevents aspiration? A. Feed solids first, liquids last. B. Place bed in semifowler position. C. Provide a 30-minute rest period prior to mealtime. D. Provide a straw. The correct answer is provide a 30-minute rest period prior to mealtime. A rested patient swallows better. The patient should be upright, high fowler, and straws should be avoided. Question 61. A patient reports feeling nauseated and unable to eat the meal tray. What is the initial action? A. Remove the tray from the room. B. Administer an antiemetic immediately. C. Explore why the patient does not want to eat. D. Offer high-calorie snacks. The correct answer is remove the tray from the room. Remove the noxious smell, the food, first, then manage the nausea. Question 62. A patient with alcoholism is admitted. The nurse plans for administration of which nutrient? A. B vitamins. B lipids. C fluids. D C vitamins. The correct answer is B vitamins. B. Vitamins, especially thiamine, are depleted in alcoholism and are required to metabolize alcohol. Question 63. A nursing student is caring for a patient with a new gastrostomy tube 12 hours ago. Which action is correct? A. Using a cotton-tipped applicator with sterile saline to clean the site. B. Washing with a wet washcloth and soap. C. Adjusting the external disc every 3 hours. D. Taping a gauze dressing over the site. The correct answer is using a cotton-tipped applicator with sterile saline to clean the site. New sites require sterile cleaning. Soap and water are for healed sites. Question 64. A patient advances from NPO to clear liquids. Which assessment indicates the diet should not be advanced? A. Consumes 75% of liquids. B. States they are hungry. C. Abdomen is soft, non-distended. D. Reports fullness and diarrhea after breakfast. The correct answer is reports fullness and diarrhea after breakfast. Fullness, diarrhea, nausea, or distension indicate intolerance to the diet advancement. Question 65. Following small boring tube placement, which action best confirms correct placement? A. Auscultating bowel sounds. B. Measuring pH of aspirate. C. Measuring residual. D. Ensuring validation by X-ray. The correct answer is ensuring validation by X-ray. X-ray is the only definitive method for verifying initial tube placement. Question 66. A nurse attempts to flush a feeding tube but it is clogged. What action is taken next? A. Use warm water and gentle pressure. B. Use the stylet to unclog. C. Administer cola. D. Replace the tube. The correct answer is use warm water and gentle pressure. Warm water and gentle pressure are the standard first intervention. Stylets can puncture the tube/patient. Question 67. A patient taking which substance requires collaboration with the surgeon due to bleeding risk? A. A vegan diet. B. A nutritional drink. C. Ginkgo biloba and aspirin. D. A breastfeeding. The correct answer is ginkgo biloba and aspirin. Ginkgo biloba and aspirin both increase the risk of bleeding. Question 68. A patient has ill-fitting dentures. What modification to their diet will a nurse suggest? A. Clear liquid. B. Full liquid. C. Mechanically altered. D. A honey-like liquids. The correct answer is mechanically altered. Mechanically altered, chopped/ground, foods are easier to chew than standard solids but more nutritious than liquids. Question 69. A nurse prepares patients for postoperative discomfort using anticipatory guidance. What is an example? A. Teaching rhythmic breathing. B. Telling the patient to visualize a pleasant place. C. Explaining about expected incisional discomfort and relief methods. D. Suggesting the patient focus on a mental image. The correct answer is explaining about expected incisional discomfort and relief methods. Anticipatory guidance involves preparing the patient for what to expect, pain, nausea, so it is less frightening. Question 70. A nurse is assessing developmental levels. Which person is experiencing developmental stress? A. Infant learning to turn over. B. A school-aged child learning math. C. Adolescent who is a loner. D. Young adult with friends. The correct answer is adolescent who is a loner. An adolescent loner is not meeting the developmental task of belonging to a peer group. Question 71. A patient with a spinal cord injury has no sensation below the waist. What is a priority intervention? A. Taking care with hot beverages to prevent burns. B. Providing adequate pain relief. C. Monitoring for depression. D. Offering meals high in carbohydrates. The correct answer is taking care with hot beverages to prevent burns. Lack of sensation places the patient at high risk for burns from hot liquids. Question 72. Nurses in a trauma ICU experience high stress. Which stressor is most likely? A nurse manager support, B a healthcare benefits, C debriefings, D incivility or bullying. The correct answer is incivility or bullying. Incivility and bullying are significant workplace stressors in high-pressure environments. Question 73. A student feels extreme fatigue and wants to sleep all the time during exam week. How does the nurse frame this? A. Asking if they are worried about failing, B. Telling them to sleep 7 to 9 hours, C. Evaluating drug use, D. Explaining that some people use sleep as a coping mechanism. The correct answer is asking if they are worried about failing. Fatigue can be a somatic symptom of anxiety or a coping mechanism, withdrawal. Question 74. A patient diagnosed with pancreatic cancer says, "This must be a mistake, I'm a vegetarian." Which defense mechanism is this? A. Projection, B. A denial, C. Displacement, D. Repression. The correct answer is denial. Denial is refusing to acknowledge the presence of a disturbing condition. Question 75. A young mother of a special needs baby is unkempt and says she has no time for anything else. What is the priority intervention? A. Remove the infant from the home, B. Inform family members, C. Increase nurse visits, D. Recommending respite care. The correct answer is recommending respite care. The mother is experiencing caregiver burden. Respite care provides a necessary break. Question 76. A nurse teaches relaxation techniques. Which statement indicates a need for additional teaching? A. I must breathe in and out in rhythm. B. I should expect my pulse to be faster. C. I can expect my muscles to feel less tense. D. I will be more relaxed and less aware. The correct answer is I should expect my pulse to be faster. Relaxation should slow the pulse, not speed it up. Question 77. A student is anxious about a breakup before a wedding. What is the best response? A. Can you tell me what part of this is most problematic right now? B. What alternatives can you think of? C. You might start by evaluating your relationship. D. It may be best to not think about this. The correct answer is, can you tell me what part of this is most problematic right now? Identifying the specific problem is the first step in crisis intervention. Question 78. A pregnant patient says, I worry about being able to handle becoming a mother. The nurse plans interventions for A. Poor coping skills, B. A denial, C. Uncertainty and anxiety due to change in role, D. Low self-esteem. The correct answer is uncertainty and anxiety due to change in role. The patient is expressing anxiety about a rational role change, not denial or low self-esteem. Question 79. A partner yells at a child after being reprimanded at work. This is an example of A. Denial, B. A sublimation, C. Displacement, D. Dissociation. The correct answer is displacement. Displacement is transferring anger from a stressful situation, work, to a safe target, child. Question 80. A nursing student feels mild anxiety before procedures. How does the professor respond? A. Suggest seeking professional help. B. State that mild anxiety can aid in learning and growth. C. Suggest the student is in denial. D. Ask about panic disorder. The correct answer is state that mild anxiety can aid in learning and growth. Mild anxiety increases alertness and perceptual fields, which can actually aid learning. Question 81. An older adult's son died 20 years ago, and they haven't enjoyed life since. This is which type of grief? A. Somatic, B. Anticipatory, C. Unresolved, D. Inhibited. The correct answer is unresolved. Unresolved grief extends over a lengthy period and involves trouble expressing or moving past the loss. Question 82. A patient with AIDS says, I've made peace with everyone, and I'm actually ready to move on. This indicates A. Acceptance, B. Anger, C. Bargaining, D. Denial. The correct answer is acceptance. Acceptance is characterized by tranquility and preparedness for the transition to death. Question 83. A dying patient says, it is unfair that I have to die now. What is the best response? A. I'm sorry you're feeling this way. B. It does seem unfair. Tell me more about how you are feeling. C. You'll come to acceptance soon. D. Tell me about your pain. The correct answer is it does seem unfair. Tell me more about how you are feeling. Validating the feeling, it does seem unfair, and inviting further communication is therapeutic. Question 84. A terminally ill patient worries about their family. The nurse asks, A. You need your sleep. B. What seems to be concerning you the most? C. Your family said they will be fine. D. To discuss this with your family. The correct answer is what seems to be concerning you the most. Open-ended questions allow the patient to express specific fears. Question 85. A patient says their daughter is appointed to make decisions if they become incapacitated. The nurse asks about A. Pulsed form, B. Durable power of attorney for healthcare, C. Living will, D. Will allow natural death form. The correct answer is durable power of attorney for healthcare. A durable power of attorney for healthcare is the legal document appointing a decision maker. Question 86. A ventilator-dependent patient asks the nurse to end my suffering. The nurse's response should align with ANA ethics. A. I will keep you comfortable but cannot administer medication to cause death. B. Removing the ventilator is active euthanasia. C. Let's talk about how you want to die. D. I'll find a colleague to help. The correct answer is I will keep you comfortable but cannot administer medication to cause death. Nurses provide comfort and palliative care but do not participate in assisted suicide or active euthanasia. Question 87. A husband says his dying wife did not want aggressive treatment. The nurse suggests discussing A. Comfort measures only. B. Do not hospitalize. C. Living will, D. A slow code. The correct answer is comfort measures only. Comfort measures only focuses on dignity and comfort rather than life-sustaining measures. Question 88. Parents of a NICU infant are fatigued and guilty about neglecting their toddler at home. The health problem is A. Dysfunctional grief, B. Fear about being a burden, C. Impaired ability of caregiver to perform caretaking, D. Impaired health maintenance. The correct answer is impaired ability of caregiver to perform caretaking. The parents are overwhelmed by the demands of the ill child, impairing their ability to care for the family. Question 89. A nurse is caring for a dying patient. Which action is appropriate? A. Avoiding disturbing a comatose patient. B. Holding the hand of a dying patient and crying with the family. C. Requesting a social work consult for complaining family. D. Performing hygiene for the patient to save time. The correct answer is holding the hand of a dying patient and crying with the family. Empathy and shared sorrow are appropriate in end-of-life care. Question 90. A new graduate performs post-mortem care. Which action requires correction? A. Leaving the patient in a sitting position. B. Placing identification tags on the shroud and ankle. C. Removing soiled dressings. D. Ensuring a death certificate is issued. The correct answer is leaving the patient in a sitting position. The body should be supine to prevent blood pooling/discoloration in the face. Question 91. The family wants to wash the deceased patient's body. The nurse should A. Refuse, as the funeral home does this. B. Refuse due to policy. C. Provide supplies and watch them. D. Provide supplies, assess cultural needs, and offer assistance. The correct answer is provide supplies, assess cultural needs, and offer assistance. Washing the body is a significant cultural or religious practice for many and should be supported. Question 92. A competent older adult refuses artificial nutrition against her daughter's wishes. Who is the decision maker? A. Patient. B. Patient's daughter. C. A healthcare provider. D. Ethics consult team. The correct answer is patient. A competent patient retains the right to refuse treatment, even if the family disagrees. Question 93. A patient with a terminal illness is in the denial phase. They might say, A. I can't wait to plan next year's beach vacation. B. I've chosen my music for the service. C. The hospital staff are idiots. D. I cry wondering how my children will cope. The correct answer is I can't wait to plan next year's beach vacation. Planning for the distant future indicates a refusal to accept the terminal nature of the illness. Question 94. A hospice patient has irregular breathing, apnea, and mottled skin. The nurse, A. Activates rapid response. B. Contacts respiratory therapy. C. Prepares the family for imminent death. D. Inserts an airway. The correct answer is prepares the family for imminent death. These are classic signs of imminent death. The priority is preparing and supporting the family.